You're listening to Community Forum on KCCC 930 AM, sponsored by Eddy County, honoring God, country, and family, thriving with industry since 1889.
Thank you for listening to Community Forum. My name's Johnny Chandler. I'm the owner of KCCC 930 AM and the host of Community Forum. And with me today for the first time, I've been hosting this thing for 3 years, guys. You guys don't know that, but you're on now. I've been hosting this show for 3 years now. For the first time ever is the Artesia General Hospital. Welcome.
Thanks. It's great to be here.
Okay, so you were listening to the radio, so you guys can't tell this. You guys don't know this, but I'm going to tell you. To my left is Jose Gurrola.
Yes,
Did I get that last name right? Jose Gurrola. He's the Chief Operating Officer of Artesia General Hospital. We're going to get to meet him here in a little bit. And then across from me is Kush. Kush is the Director of Public Relations for Artesia General Hospital. But I think you've been around, man.
Yeah, I've been here for, I think, this area now about the last 10 years or so. It's great. I love it. I choose to live here. So
Yeah. And so my wife and I chose to move here 3 years ago. I don't see us moving anywhere else. We also have the Balzano Vineyard and Pumpkin Patch in between here and Artesia. So we have a lot of hats in the ring as well, or irons in the fire, just like you. And so I want to ask you real quick. So, we partner with Southeast New Mexico College. We're actually in the library recording right now. Great partnership. Am I right or am I wrong in thinking that you designed the first logo for the newly independent college?
that is correct.
I was right. I was talking to Jose before we recorded. I was like, I'm pretty sure he recorded the first design because I was at the Board of Trustees meeting, a well-deserved round of applause. And I know they updated the design a little bit, but obviously you were instrumental in SNMC and those key moments of making sure that we can get independent. So thank you for that.
Thank you. Appreciate that.
If it wasn't for Jose, if it wasn't for the fact that this college was independent, this radio station would not be possible.
Sure.
Because then they would have sent everybody to Las Cruces, because Las Cruces and New Mexico State University has a great broadcast program, an amazing journalism program, and they wouldn't start one here when they have one at the main campus. So I'm not going to thank you personally. You're just part of a whole group, Kush, so thanks again.
Thank you.
All right, let's segue and get back to on topic. We're here to talk about the Artesia General Hospital. This is what I know about the Artesia General Hospital. Jose is a COO. You can tell us more. You guys are located in Artesia.
Correct.
That's what I know, or at least the headquarters is.
Absolutely. So, Artesia General Hospital, we were established there in 1939.
Wow, okay.
And in 1980, they built the hospital which we're currently at. We kind of relocated to that 72.
And that was in 1980?
That was in 1980.
Okay. Now, where was the original hospital at? Do we remember?
Wow, I heard the name of the street. It's still, actually, there's still some remnants of the original hospital there in Artesia. But we've been very blessed and fortunate to kind of position ourselves where we're at there in the community. So, again, over 80 years in the community that we've been there. The community, the support there that we get from the community for the things that we do have or that we're trying to achieve and get,
right,
is very well supported.
So, do you have an idea? I'm going to ask you maybe some pop quiz questions that I wasn't prepping you for at all.
Yeah, sure.
Do you have an idea of how many patients you see annually? Just real rough roundabout numbers.
Sure, we're rough round. I don't have my stats in front of me, but.
Right.
I can tell you, as far as outpatient services that we see, monthly, we're averaging over 5,000 visits within our outpatient services.
Right,
and,
that's good enough number for me, Kush. No?
Yeah,
that works for me, man. Yeah.
And other radiology, other labs, they're significantly high. We're processing, over 16,000, labs there a month,
So the labs are, I don't know much about hospital care. I just know that anytime I need any blood work or any labs done, it is not an inexpensive venture, right? So labs are obviously a key component for any hospital because you got to be able to turn those tests around quickly. Otherwise, you have to ship them somewhere else completely. So talk a little bit to me about the labs or the testing that your hospital system does offer.
Yeah, labs are a critical component, of any healthcare system. The diagnostics, like our radiology as well. But for primary care, for specialist care, making sure we can do those complete metabolic panels or complete blood CBCs or A1Cs, the things that are important for treatment to those patients who have some kind of chronic condition or who are looking for preventative type care so they don't get those conditions.
Right.
So it's very important. It's very critical. It's mission critical to our organization to make sure that we provide those top labs.
I'm going to come back to you. I want to go to Kush for a minute. Kush, how long have you been the Director of Public Relations at Artesia General?
I think about 2.5 months right now.
2.5 months. I thought it was pretty new.
Yes.
Right. So, what's your goal? You've always had a director of public relations job, I assume, at the hospital, right? And so I think you had a longtime individual that retired not too long ago, I assume. I think I remember Rhonda potentially. But so the idea is since you've taken over for 2 years, like I told you, I know what Artesia. This is what I know about Artesia General Hospital. It's in Artesia, right? So as obviously you have a charge, you have a goal as director of public relations. So why don't you share with us a little bit about what your passion is for the hospital so far and what your plan is moving forward?
You know, one of the nice things about working for a nonprofit is that we get to do some really, really good work in the community. It's personally, I think, just helping spread the word that A, we exist, and B, all the different services we offer, not just in Artesia, but also here in Carlsbad. You know, a lot of people don't know that we have facilities here. So one of the goals is to change that and make people aware, whether it's our family practice center, whether it's, the orthopedics, whether it's behavioral health, which is a big issue generally all across the country. So those are some of the things. In addition to that, I think is just telling our story. Our story is just an important part of who we are. You know, we talked about being in the community for the last 80 years or so. We're looking forward to being here for the next, 800. I know I won't be around, but part of it is setting that success story up as well.
Okay. So, Jose, can you tell me, or Kush, whoever's better for this one, tell me where in Carlsbad your offices are located. I can picture one.
Yeah,
I think it's like, is it on Canyon or Main Street?
It's on Hagerman, right? It's Hagerman is our family practice clinic that we've got there. We've got two providers there, Rebecca Nolan as well as Ashley, who just recently joined us there in the clinic. But here on Pierce Street, let's see here. Actually, orthopedics. We got orthopedics
right off of 8th Street.
Right.
Okay.
Left, yeah.
And then I remember seeing one kind of near downtown, a building downtown. I thought Artesia General Hospital building south of downtown on Canyon or Main.
It's kind of on Main. That's the one that's Main and Hagerman.
Okay, that's the one.
Hagerman's kind of the official address, but
Right,
it's
right.
right behind where the school administration building is.
Yeah, right, exactly.
So right behind there.
Yeah, they're nice looking buildings, I want to say. Like they look like they're pretty new.
So some of the services that we do have here, include the family practice clinic that we've got on Hagerman Street. We've got the open MRI that's been in here, I think, for years within the community. Actually, that's owned by Artesia General Hospital.
What do you mean? What do you mean by open MRI?
So open MRI is actually it's our imaging and diagnostic center here. So we've got an MRI, an open MRI there for patients who are looking for an outpatient test.
So the open MRI means that, like, I guess there's a claustrophobic association with the MRIs.
Yeah.
Thankfully, I've never had one.
Yeah,
right.
So anybody who had an MRI, it could be a little bit scary, with the noise and you're right, the claustrophobic, it's pretty tight in there. But having an open bore and a nice open room can kind of alleviate some of that, that
So
stress.
as COO of Artesia General, what do we use MRIs for? Like what are we diagnosing with MRIs? They're very common. Obviously, that happens all the time now. And I thought when I was younger, it was like a newer thing.
Absolutely. I think the biggest things, those chronic conditions, but strokes is an important one. We're currently embarking, just some new information to share with you guys. We're getting a new MRI.
A new open
at
MRI machine or closed or is it like the futuristic MRI?
It's a futuristic MRI. In fact, we'll be one in 7 hospitals in the nation to have this MRI there at our Artesia General Hospital.
This model of MRI, right?
Yeah,
So like the latest generation, I assume.
It is. It's a Fuji Echelon. It barely came out here in November, December, FDA approved, and it's got some cool AI technology behind it, the imaging quality on it, the big bore, there to for those patients who need that open MRI, that to alleviate some of that stress or anxiety getting into an MRI. But ultimately, going back to your question, about the diagnosis there, it's really to identify faster those conditions that the physicians are looking for. We're looking at the times, for instance, strokes. It could be a matter of minutes to, instead of 30 minutes or 45 minutes to get an accurate quality of test to rule out these conditions. So with that being said, better image quality, better outcomes for the patient,
faster diagnosis. Yeah, right, absolutely. So, just how big of a deal is it for Artesia? And I love Artesia a lot. I like Carlsbad a lot. The sense of community in both these small towns. I lived for 3 years is great. I'm still going to classify as a small towns, but it's really wonderful, and everybody supports each other way more than when I lived in Albuquerque for a while. So how big of a deal is it for Artesia General to get one of these new MRI machines in dusty old Artesia, right? I mean, if you're in some big city, you're the Mayo Clinic, you're thinking dusty old Artesia probably, you know what I mean? Just a little bit. So it's like, how big of a deal is this? Did you just pull some strings?
It's a huge deal.
Right.
I'd second that.
Yeah, these pieces of equipment, they're expensive, right?
Right. Yeah.
But again, knowing that this is going to provide the better outcome, better, healthier community, something that we can offer there. I think that's a good trade-off there. But these little machines can be anywhere with you from 15 to 25 years.
Right.
So definitely, this new piece of equipment that we've got, will be with us for a few years.
Well, just the operating cost of it too, right? It's not like you can just buy the equipment and you no longer need a person.
Preventative maintenance
right.
on those
things,
right. And
I
the staff to.
Oh yeah, I'm sure the company every 100 hours has got to be down for some maintenance or something. Just like that just happens all the time. But I can hear your passion for just this one piece of equipment. I mean, Kush, you're a bit of a communications guy, so you like audio. You like, when I get the latest, greatest new piece of audio equipment, I'm nerding out equally the same way.
And it kind of demonstrates our commitment to the communities that we serve. I mean, we've got people coming in for not just Artesia and Eddy. We have people coming in all the way smaller towns as well. That's part of our commitment to all of y'all, is trying to make sure that we have the right equipment, we have the right people, we have the right services. So when you tell us, hey, we need this kind of physician or we need this kind of service, we take that seriously. We're listening to that. Now, of course, it doesn't always work out, but that doesn't mean we're not listening.
Right. So I think one of the challenges that we have here in the community, we're a rural community by definition, especially federal definition. And then we've always heard about hospitals, lack of hospital care in rural communities. I'm going to say from my perspective, I don't feel like we really have a lack of hospital care or hospital systems in Eddy County. I think we have 2 hospitals that are willing to help you in an emergency at any moment you need it, which is what you're really worried about. The biggest thing. But there's also seems to be quite a bit of services for our community. But are we still having a hard time keeping up with the growth in the community when it comes to a matter of fact of how many physicians we have? We're growing so quickly, the number of services that we need. And are we as a community being overwhelmed for hospital care, despite how hard everyone's working?
Yeah, that's a very good question, and this is, I think, challenges that not just rural communities face. I think even in the larger cities, with the growing population, is how do we not just retain the physicians or providers within our organization, but how we recruit and bring those here to our rural area. So definitely, having state-of-the-art equipment, having a great culture within our organization, a great community backing, some that support, having a good work-life balance there for that we offer, because we've talked with a few physicians or providers who come from bigger cities, and they're actually, you'd be surprised, they're really kind of sold on wanting that travel time back, instead of an hour,
right.
5 minutes or 10 minutes to get to
or
to
even
work.
15 or 20, but it's an open highway, right? So I have this vision of ER. So tell me a little bit about your ER situation, emergency room situation, right? So I think the only level 1 trauma center we have, the closest one's Lubbock, I believe, right? So Albuquerque's level 1 trauma center. I'm sure El Paso is too, but then also Lubbock. So, but being a level 1 trauma center with the very little amount of knowledge I know is such a huge lift for a hospital, right?
Sure is.
We don't really have the demand, and thankfully we don't have the overnight gunshot wounds coming in, or we need something like that, which maybe one of our large cities in the state has, to be nameless. But so my point is, but when I think of ERs, I think of, this is how old I am now, and I think Jose, you and I are about the same age. You might be a little older than me, Kush. Is the idea that of ER, the NBC show ER, where those emergency rooms are just rocking all the time. They're 24 hours, no sleep, sleeping on some extra bed when they get a chance. Is it really? It's probably not that way here. Would be my assumption.
Well, I think we all have our sets of challenges and types of patients or situations that we're confronted with, that come through there, whether it's bigger cities or rural areas.
Right,
That's
right.
really unique. But speaking of with the trauma, type designations, you're right. We have bigger trauma centers around us, level 1s, 2s, 3s. Right now, something we've been working on for the past year is getting our trauma 4 designation.
Trauma
there.
4. So, I guess my main question is your ER open 24/7?
Absolutely.
Okay.
Yep.
And so is that like what trauma level are you technically on currently?
Well, we're like I said, we're going for trauma 4
Okay.
designation. So right now we're practicing as a trauma 4.
Okay,
facility.
right. You got to do it before you got to practice it before you can do it.
Yep.
Right.
There's other components, as you go up to trauma 3s, 2s, and 1s. I think our ultimate goal, and we'll kind of get into some of the new happenings of what a new hospital would kind of look like,
Mm-hmm.
but. With that trauma 4 designation, kind of gives us a goal to shoot for the next designation, and what does that entail, and what do we need to do
Right.
there?
I just think that it's a heavy lift to do these things. Like some of them involve like having a doctor that can do open heart surgery on the fly, on call, ready to go. That's like where level 1 comes in, right? Where you have to open somebody up on the fly and on call. So those are just heavy lifts, and you also have to have a population demand for that. And it's a positive thing that we don't really have that demand, because a lot of it is negative events that lead to that.
We do. We're very fortunate, to have those 1s and 2s, around the community that we can, transfer those patients to. They're teaching universities. They have specialists that that we would be unable to get because of whether it's equipment or just the population.
Right, the education aspect of it, right? Sometimes it takes numbers, it takes scale to try new things, to invest in new things, and so we get it. But I think so. I mean, New Mexico seems to be doing, from what little I can pay attention to on the state legislature side, they seem to start to be making some of the right moves to make sure we don't completely turn physicians away as a state. Right. You know what I mean? I feel like that started to happen. But I want to segue from that. For certain, I want to learn a little bit more about you, Jose, as far as the idea. You are COO of a hospital system, and before we started recording, I asked if you were a doctor, right? And so I also had this assumption that if you're going to be the CEO or COO or CAO of a hospital system, that you maybe have to have a medical degree, but that's not the case. So go ahead and tell me how you got into this and how you became passionate in the medical field. You don't rise to COO if you don't have a passion for what you're doing.
Right. Yeah, you're right. I'm not a physician or a provider, but I have it started out. It stems all the way back to high school. Worked first off, delivering oxygen and setting up these hospital beds for like hospice type patients, palliative type care, and having interactions with patients and knowing that what you're doing has a purpose, right? And seeing some type of satisfaction, from the customer or patient, I think was one of the driving forces that you appreciate and you look for each and every time. So, as I kind of moved up, along the way, went to school there here at Eastern University. Roswell first, and went into medical assisting. Just wanted to try, hey, let's try something. Let's see what that looks like. Spent some time within the outpatient within the clinics to several specialties. Finding that purpose, and that value that you bring doing that job that nobody wants to do. You put your hand in there, you put your foot in there and say, hey, I want that. You challenge yourself. And, one thing I'll steal the words from our CFO, Corey Yates, she speaks to this. She says, if you love what you do, you're never going to work a day in your life.
Sure.
And
kind of.
True. But it really does. You love what you do, and you have that purpose. So every day you come to work, you're going there to fulfill that mission. To make sure that patient or that community, that we're providing the best we can. So kind of going forward, I went to school there to Portales. There got my undergraduate. And actually a pre-med. I was looking at becoming a physician assistant there. Went through the programming there, and I got called back to work at the hospital system in administration. So I took that role while I'm kind of waiting, for these acceptance into these programs. But opened me up to a different whole other a life within a hospital, within a healthcare organization,
Right.
and administration. You're looking at regulations, quality, policies. More so along revenue. What does it take to
Yeah.
keep this machine rolling?
And there's some more regulation on top of that, right?
Yeah, more
Sure.
regulation, and it's policy, legislation, and just the impact. So you go from having that direct patient care portion, then to moving it to like this business type model. So I got my master's in healthcare administration, through Ohio University, and it provided a good open spot segue, good understanding.
Right. So once you get to a certain point in your education, there's literally pathways to help with that.
Yeah.
So I'm interested in the relationship between a hospital administrator such as yourself, risen to a certain level for sure, versus like an MD. Right, like how, because MDs are going to sit on the boards related to what you guys are talking about, very influential to everything that you're doing, right? So how is it difficult? Is it easy? You tell me, what's the relationship like when you have these very educated doctors who are the reason you're in business?
It's great, and it's always a learning experience. I think we're all there to achieve one goal, and I know we might have different ways, different paths, that we're taking to get to. Whether an organizational goal or patient goal, but either way, we're ultimately there as a team, as a community, and to provide that outcome for the patient. So, it's very interesting. You get that administrative aspect, you get the physician aspect, and currently, right now, Dr. Salgado from Artesia, he's our CEO. And also a practicing medical director, there in Artesia. So it makes it a very unique administrative or hospital, should I say? Because he provides that clinical experience, that knowledge, that also, that administrative.
It eliminates the idea that you haven't even done this before. How can you tell me the procedures related to this that you've done? It eliminates that gap. We don't have a whole lot of time left already. We're getting pretty close to the end, but I wanted to address something. Obviously, whatever else you want to talk about. But before we started recording, Kush, I'll let you start with this one, or maybe Jose wants to. And then since we've been recording, I've heard the term new hospital right before. I heard it once before we were recording, but didn't hone in on it. Heard it again just now. And so I'm feeling like there's some type of announcement or something you all want to tell us that I've buried 22 minutes into the program.
So I think one of the nice things is we're looking at how do you kind of take medicine into the next decade, the next sort of century. We're fortunate that we're looking at the construction and programming of a new hospital right now. It's going to be a little bigger. It's going to be, of course, the latest and the greatest technology, but not just a whole hospital. We're also looking at a whole community, which includes housing, includes potentially some retail, things like that. It's going to be in Artesia, right off of 285, with a little easier access right off the highway to get to.
So we're looking at, it's the stuff. When it comes to construction, folks, I'll just tell you, I worked a little bit for the city of Albuquerque in the construction department. It's all seasons. It's all yes and this. It's all very planned out. It takes very much longer than you'd ever want. But if you're already looking at you're already thinking of a location, you already probably have some land in mind, or already purchased land, either way, north or south of Artesia.
It's a little bit north of Artesia as you're kind of coming in from the Roswell side, but it's still really close.
Well, Tractor Supply is what I consider north of Artesia.
So you're right. There's that open land right there, open space by a Tractor Supply company there. In fact, our hospital district did purchase that.
Correct.
We have that land. So that's kind of where the new location of the hospital.
Okay, so we're talking a whole new thing from scratch pads all the way up, right?
Everything all the way up.
Now, how big is your facility currently? Without telling me the square footage, right?
So we're currently a 25-bed facility.
Okay, all right.
But
that's how you do it, right? Beds, heads and beds, patients and beds, not I have a 2,000 square foot hospital room, right? Sorry, right.
So we're still in the programming stages for the new hospital. So we kind of have a box, and now what we're looking at is how do you go in and fill that box? We're literally going to get down to the nitty gritty. How many steps do our nurses take from this door to the bed? How many steps is it to the medicine cabinet? Look at how we make all of those as efficient as we possibly can. So there's a lot that goes into that programming stage. Probably looking at about a couple of years for that, and probably about another 2 years or so after that for construction.
Can I get in a little bit to how your nonprofit, how are you funded mostly?
So we actually have a couple different boards. We have the district board, which is kind of the organization that we actually rent the building from.
Okay.
And the money that goes to them essentially, and a lot of that comes back to us, so we're able to kind of better our facilities, better our services, things like that. We also have in what I refer to as an oversight board. And yeah, it's a little confusing when you kind of first get there and you're learning about it. So we actually have a couple different boards, but Jose, help me out here. I know a lot of our funding also comes from insurance and
Mill levy.
Mill
levy. So there is a mill levy for that, right?
is,
And that comes up like once every 10 years or something, or is this
every 4 years?
Okay, this
It's
one's every
actually
4.
coming up this November.
In November, it's coming up,
Correct.
right? So and when it comes to asking residents to approve a mill levy, right, to vote yes on it again, are you limited on how you can talk about that?
No, we're
Okay.
actually, I'm told we're allowed to say yes. Now, of course, hopefully that doesn't come back to bite me.
Okay,
But
yeah.
I'm told we can say vote yes.
Right. So because there's also a education bond 2 issue that's coming up on November 5th as well,
Correct.
right? Where SCMC is asking for $5 million to help towards the T2 building that they're
Correct.
working on. But since, I mean, it's like, I own a radio station, President Beardmore, I'll say anything you want. It's like, no, you're employed by the college. All you can do is tell people what is not going to happen or what will happen as a result of voting yes or no. You can't encourage them either way. But you guys are allowed to.
Yeah, I think it's very important, though, that we get to showcase some of the good work that our hospital district has put into the hospital, that through the funding, like the MRI machine, like our CT scanners, and all these different projects that supported, that supports the health, the outcomes of the. So it's very important that we get that message in front of the community so that it's just not a yes, or they just see it and read it. They know what it's going to.
Right, would they see the services directly? And nobody knows that they really need a hospital until they need it, I guess, right? Or the family member needs it, then it's the first place you go. So one question for you, or Kush, you can answer this one very easily. If a voter was to vote yes for the mill levy for the hospital in November, would it raise their taxes?
No, it would not.
That's the key point right there. I was like, it might lower them a little bit, but not significantly enough to where it's going to be beneficial for the services that they offer.
Correct.
It just would not pay off. If it's not going to raise your taxes, Eddy County already has some of the lowest taxes in the state as it is anyways. Artesia, Carlsbad, I mean, even with the gross receipts tax, it's much, much lower than anywhere else in the state. So we have good tax policy here in the state of Eddy County, I believe. So if you go ahead and say it one more time, encourage voters to do what in November?
Go ahead and vote yes on the mill levy. It does not raise your taxes. It allows us to bring in services. I'm going to put a plug in here. We just got a new cardiologist. So if you need cardiology services, that's one of the way the mill levy helps out.
Doesn't it seem like, and none of us are doctors, but doesn't it seem to me like cardiology seems like something that I just seem to know a lot more people that are in need of that, whether it's the angioplasty or they're going in for a quick checkup, and before you know it, it's like so the medicine has gotten so good around it, they can really get you fixed up quickly and back to work in no time. But the idea is it feels like that's a higher demand. Now, I don't know if that higher demand for that is because I'm just getting older, right? And all my friends and relatives are also getting older.
And that's a good point. And I kind of answer that question this way. Once I turned 40, and that's been a few years, I've kind of become a lot more interested in what healthcare options are around. So.
Yeah, no, you're absolutely right. I'm officially I'm 44, right? And I might need to get some glasses here pretty soon, right? And so I'd like to know like the differences. Like some of this stuff is just part of aging, so don't freak out about it. But when you were in your 20s and something happened, it wasn't a part of aging. You thought you were dying, right? So it's like very difficult. Real quick. Yeah. So you guys obviously will take patients by law, basically, that do not have insurance, right? So you do get refunded from the state if you have somebody that shows up without health insurance?
We are a nonprofit there, so we have different options there to make sure that patients.
Right, you guys work with Medicare, Medicaid, things like those type of things.
Right, and we have sliding fee schedules, to make sure they can afford the.
Now, what do you mean by sliding fee schedule?
So,
Tell me about that a little
based
bit.
on the income
okay.
that they have,
right.
that they can afford. There's a formula, there's some calculations there that we help them. That way we make the healthcare affordable.
Yeah, so I'm going to tell Kush. Kush, go ahead, and I'm going to tell a quick story.
I was going to say one more thing that people should be aware of is that we also do offer a transportation option for patients from Carlsbad and Roswell for a small fee. We'll come pick you up. We'll bring you back to all your AGH appointments.
Oh, okay. All right. No, that's great. That's very interesting. So I was in Italy recently. We also have a friend that his mom still lives in Italy. Just not get more specific. Mom is about 80 years old, okay? Sure. They do have socialized healthcare in Italy and all of Europe, right? She needed a new hip. They sent her home. No hip, right? Just so you've reached the age to where we're no longer going to give you significant medical care, right? That's kind of sad when you think about, because you think about the idea of, oh, man, I wish I didn't have to pay health insurance as a young person. I wish I had health care like they did. But then when you're 80, they literally cut it off as to when they think you're worthy of medical investment or not, right? And so his mom was flown to the United States, got a new hip, is back in Italy, and has another solid 10 years at least, right? I mean, pretty easy. So it's easy to trash the American healthcare system from an outsider's perspective simply because it just feels like it costs a lot. And when you're not older, you don't use it as much, right? But I'm paying for my parents and my grandmother, and hopefully somebody behind is going to be able to pay for me. That's why we pay into these systems. That's why Social Security's there, whichever one it is when you're older. I think it's Medicare when you're older. I always get Medicare and Medicaid mixed up.
You're right.
Okay, right. So my point is that I know it feels like it's expensive, and I actually believe it kind of is. But the idea is there is something you're getting out of it that you're not getting from other places that you think is great on the surface, and it's probably not.
Yeah, we here in the hospitals, as with new laws and things, there's that transparency, price transparency that we can all go and look. The consumer now has the ability and the right to go over there and look at what their pricing is, their structures are, to find out what the best, affordable.
Tell me about what's that been like since those are fairly new rules in the state of New Mexico, I believe, and so I think that there's some historic legacy of that. But just upfront pricing or this, whatever the public pricing, does that really make a difference? Do you think?
It's for us as we look at. For me, I would say no. But to the consumer, it would make a difference. But
if I'm going to have an elective procedure, maybe it would make a difference.
Yeah.
Right. I'm electively doing something, then of course I might take costs into effect. But in an emergency, don't really care what the cost is. I don't think.
Right.
I'm kind of getting sidetracked here. I'm not really sure what my point is. My point is that I think hospital and medical care and the money associated with what it costs to get certain things done is sometimes arbitrary, depending on what I need to get done.
Yeah, and you're going kind of listening to what you're saying, and Medicare, Medicaid, some of the reimbursement, for those types of procedures or the visits, the things, it's kind of remained, kind of status quo while we're all feeling this, inflation from, the price of food, the clothes, everything's going up, and kind of the things remain status quo as far as reimbursements for hospitals. So this kind of goes around the nation. We got to think of ways too, to survive, and whether it's innovation, new service lines, or looking at how do we make adjustments to certain whether they're procedures or testing, right? To kind of look at offsetting some of those costs, but very strategically. But it's a challenge, I think, for everybody across the board.
Yeah, I'm not really sure how any hospital operates at a profit. Personally, I just don't know how. But that's not for me to know, or is it for me to necessarily learn? That's why I have guys like you on all the time, right? I don't need to learn it. I'll just have the experts on myself. So we are getting pretty close to time, but I want you guys to close out. I don't necessarily have a very specific question for you. I do want to say that there was a lot more that Artesia General is offering that we even bothered to touch on. Sure. Right? I'd love to have you guys on again. I think let me cover the main themes again real quick. You are in Carlsbad. You do not have to be in Artesia to go to Artesia General Hospital. You offer emergency room services. You're open 24/7. A brand new MRI machine. You got family care offices here. You've got orthopedics down here as well. You mentioned
orthopedics, pain management.
You're not in a community where there's only one option. And if you're in Artesia, you're not in a community with only one option either, right? So we have a fairly robust medical system here. So I just want to close with whatever you guys would like to say. We're going to start with you, Kush, then we're going to go to Jose.
I kind of just really want to add that even with our family practice, if we have an open same-day appointment, we will try and get you in. So it's in your benefit to call and ask.
Okay, great. And so you guys book pretty quickly? I don't have to wait a month and a half or 2 months for an appointment?
We try not to let it get that long. So
that's also based on demand of the community.
Correct.
Right.
Absolutely.
Jose, close us out.
Yeah, again, having this unique area, servicing this unique area is a blessing, and I think we take it as a challenge. But all the services that we provide are for the benefit of the community, and we hope they utilize that, from endocrinologists to pain management specialists, hyperbarics wound care that we offer down in Artesia. There's a lot of conditions here within, looking at community health needs assessment of what the community needs and wants. We have those services, so it just takes a little bit of research, a little bit of asking. The community, look at our page, look at our services, come to our clinics here in Carlsbad, behavioral health, family practice, and ask about our services, and we'll be able to provide you some more of the extended service specialties that we have within our network.
Well, I appreciate both of you coming on. That's Jose Gurrola, COO of Artesia General Hospital, Kush, Director of Public Relations. It is comforting to know that we have hospital systems in Eddy County that can provide just about every service possible. So thank you guys very much.
Thank you.
Thanks for having us.
You're listening to Community Forum on KCCC 930 AM, sponsored by Eddy County, honoring God, country, and family, thriving with industry since 1889.